Hey guys, it's Ken here and I'm the Podiatrist from DocPods and Ergonx, and today we're looking at a corn removal that we did about 2 or 3 weeks ago. And this one's particularly interesting because it's on the tips of the toes is where the pressure is. So what causes a corn and callus is when we get clawing of the toes and the toes actually grip the ground, or there's more pressure on the tips of the toes than what would usually be on the skin. And it's a natural reaction of the skin to thicken to protect itself. Now, unfortunately, that thicker skin causes more hard skin and more pressure. So it causes more thick skin and more pressure, and then we get this build-up of a corn or callus on the toes. Now, the patient that we're about to look at, he's someone that I've been treating every about 8 to 10 weeks for the last 3 years for this. He's a patient that doesn't want to get surgery to fix his clawing of the toes, and he's more than happy just to come in and get the corn removed from the end of his toe. And you can see the effects that this corn has on the underlying tissues. It damages and breaks blood vessels, and it pushes the tissue fluid back into the skin, so it gives it a really characteristic red-brown appearance to the callus. So we'll go and have a look at the treatment and we'll talk you through it. Okay, so this is the treatment we're doing here on this patient. So it's obviously on the tip of his second toe. So you can see there's really quite a thick callus build up there, and now we're just shaving through that down through, and you can see there's a little bit of blood, no dried up blood that's been actually inside the callus. Now, some people have confused this with a wart. As we cut down further, you can actually see there's a few little pinprick blood vessels, and that's what warts usually look like, but this is certainly not a wart. This is a thickened callus, because you can see the way we're shaving it off. The shavings are really translucent, and you can almost see through them. And if we cut a wart like this, it definitely would bleed. So, and you see we've been able to basically shave out all those little pinprick blood vessels because they're already dead. Now, what we're doing now is we're going, as it's up under the nail a little bit, we get the callusing build up of the nail bed. What we've gone up there, we'll just remove all of that as well and trim that nail a little bit shorter off the camera. And it just cleans it right up. And so the idea of what we're doing here is we're trying to relieve the pressure on the tip of the toe to make it more comfortable, and there'll be no tissue breakdown or less tissue breakdown, so we don't get an ulceration or an infection in this patient. And you can see there we've cleaned it all up, and what we do is we actually just clip that nail a little bit shorter off camera after this is done, but we try and get as much of that out as possible. And you can see there's no blood, so it's definitely not a wart or any sort of warty tissue under there at all. So I'll remove it all up, and then what we do after we finish this one, we've got a little rotary sander where we sand that smooth so it comes up looking really nice, and then we apply some moisturizer and get the patient to moisturize this one as regularly as he can, if he can reach his feet, and then that's the end of the treatment. So that's it. That's how we treat a corn or callus on the tip or the apex of the toe in a patient who doesn't want to get surgery to straighten the toes. It's a pretty simple process. We remove anything that can cause pressure on the toes, and the main thing that we can actually remove off of the patient is the callus and the corn, and try and prevent any tissue damage. It's particularly important to do this in patients that are diabetic or immunocompromised, that are at risk of infection, because this can actually lead to infection and amputation. So I hope you enjoyed the video, and we'll see you in the next video.